I'm Niki Davis. I am a medical doctor and I am board certified in both family medicine and lifestyle medicine. But I wasn't always a doctor, so I actually started out as a mechanical engineer working on the space shuttle program, which was a lot of fun and it was exciting. But once I learned about eating plant-based and how eating more plants can actually help treat and even reverse chronic lifestyle-related diseases, I just became very passionate about it. And instead of wanting to work on rockets, I wanted to help people eat more plants. Well, it's interesting because prediabetes is kind of silent. A lot of people don't even realize, really honestly, until people get to where their diabetes is very uncontrolled, will they start to notice symptoms like they're thirsty all the time or they're urinating a lot. But honestly, there are lots of people out there living with prediabetes who have no idea, because it really isn't something that you would notice symptoms of right away. The reason why we care about prediabetes, though, is that most people, if they don't make lifestyle changes, will transition from prediabetes to full type 2 diabetes. And I want to make clear that there is also type 1 diabetes where you do need insulin. It is not reversible. However, I have had patients with type 1 diabetes that once they improved their diet, were able to reduce their insulin and feel better, lose weight, all of the good things that you get from eating more plant foods. But I will say that, yeah, for most people, you're not really symptomatic with prediabetes. And so that's just where it's really important to not only get checked and get those labs drawn if you're worried about something like that, but just making sure that you are looking at your diet and working on improving that so that you can prevent that from happening to begin with, especially if you have a family history. I like to keep it really simple. It's not necessarily about, well, let's remove all these things from your diet. Let's focus on the healthy plant foods that are going to be delicious and help you with feeling healthy and reversing your disease. So yes, we are talking about removing certain foods, but I really, I eat plant foods and I don't miss anything. And I love the way I eat. And other people can get there too. So I don't want it to feel restrictive, and it shouldn't, because honestly, it is a huge weight off of my shoulders when I got to start eating this way, of not having a calorie count, not having to portion control, being able to eat when I wanted to eat, when I was hungry, stopping when I'm full, and not having to worry about every little thing. As long as I was choosing the right foods, you could forget about all of that. And so that's really something that I've found really beneficial, is just being able to enjoy life. So what I will usually talk to people about is not only removing animal foods and oils and processed foods, but focusing on foods that are going to keep you full and happy, and make this way of eating something that you can do for life. This isn't about a quick fix. This isn't about, okay, on Monday, I'm going to start this diet. It's about figuring out how to make this sustainable forever. And what I've found is that you got to focus on starchy foods, because those are the foods that are going to keep you full, keep you happy. They're the comfort foods, right? I mean, think about a big pile of mashed potatoes and gravy. That's delicious and filling. And yes, you can have that, and that can help reverse diabetes, okay? But starchy foods, so that's potatoes, sweet potatoes, grains, beans, corn. And then you also want to have your non-starchy veggies, broccoli and cauliflower, whatever you like, fruits, and then whole grains. And then, of course, legumes like beans, peas, and lentils are really important. So focusing on those kinds of foods is the first thing that we do, is just making sure that you stay full, that you're happy with your diet, that it tastes good.